Our first guest is a physician associate that specializes in aesthetic medicine. She has become South Florida's top injector with her key eye and her skill set. Please help me to introduce aesthetic injector, Chloe.
Hi, everybody. Thank you for having me.
No problem.
I'm very excited to be here.
Now, Chloe, I always like to ask my guests, how are you? How have you been?
I've been doing really well. Very happy here in Miami. It's always sunny outside.
Good. So tell us, let's bring us back to the beginning. How did you get started in aesthetic medicine?
So I graduated from PA school in 2016, and I went to Nova Southeastern University and got my master's. And I knew I always wanted to do either plastic surgery or dermatology or something in aesthetics, but I actually didn't really know too much about it back then because the field wasn't as booming or well known at the time. I think that Instagram and social media has totally blown it up, and it was kind of the beginning of that stage back then. But I kind of thought I wanted to do a little bit of real medicine and aesthetics because you don't learn any aesthetics in school. So I wanted to learn everything that I used in school. So I was okay, working in dermatology, maybe doing some medical derm and also, or a plastic surgery office where I'm assisting in surgery and also doing some aesthetics would be cool. And I was always drawn to aesthetics because it's very hands-on. That was my best skill set going through school, not memorizing information. It was more I knew I wanted to do something that was going to be more hands-on, in the surgery center or something like that. So I ended up getting a job in derm right off the bat and doing some medical derm, and I thought I was going to be doing a little bit of aesthetics, but I didn't do any in that position. I was kind of just learning medical derm, and it was a per diem, short-term position. And after that position was over, I had to find another job, and I ended up working in primary care. And that was actually the best thing that's ever happened to me because I stayed there for 3-4 years and I really got to use everything that I learned in school and built a really strong foundation of medicine. And now I have a strong foundation, I can answer general questions and be there for my friends and family if they need to know about anything with their health or whatever. So I really value that. And it also gave me a good foundation for working in aesthetics because I can, now address any adverse events or anything like that. And I'm really, experienced with the skin and medications that people are on and different, diseases and things like that. But anyway, when I was in primary care, I was oh my God, I want to be in aesthetics. And I was, on the weekends, going to any events or reaching out to the reps and just networking as much as possible and using all my days off as time to prepare myself for aesthetics because I knew I wanted to be in that. And I also started my medical Instagram, which I knew that in the future I would be able to transition it to aesthetics. So everybody was following me back then because of I was sharing wellness tips and yoga and holistic lifestyle, which is, I'm all about that. And I knew that when I did start doing aesthetics, I was going to have some sort of following to bring in patients and connect with people and things like that. So as soon as I started working in aesthetics, I was able to make that transition. And I think that, it's really important because people can see kind of where I was at and relate to me in that way. And I still try to, sprinkle in some wellness and holistic things that, I like to do. But anyways, when I was in primary care, I kept interviewing at different places and nowhere was ever kind of good enough for me to leave my full-time job with full benefits and everything like that. Because, I had a stable full-time job with benefits and I didn't want to leave for anything that wasn't a short thing. And in the aesthetics field, it's difficult if you're not going on with a plastic surgeon or a derm, a lot of med spas, might pay you less and not have a full package of benefits. And you have to be kind of careful, especially somebody with no or little experience, they're going to try to lowball you, and that there goes like, you know, your paycheck and your solid income. And then also they don't have a lot of patience for you. So, you know, if somewhere doesn't have patients already for you, you got to figure out how you're going to bring in patients. And that's another huge thing. So a lot of people will like be like, oh, we'll hire you, but you need to bring in your own patients. And if you don't have a big network or a way, like with marketing with social media or something, there's no way you're going to be able to like stay afloat. So yeah.
Awesome.
That was a lot.
Awesome. Now, you said a lot of important things I want to go back on. Now, you talked about a little bit kind of how you had to hustle a lot to kind of get your first job. Tell us, how important is it to really, I guess, use all these different techniques and as a new injector to really break in the market?
Yeah. So I know a lot of people, you know, some people just get lucky when they first graduated. They'll like, you know, rotate with a derm or a plastic, or they'll know somebody and they'll get a job right off the bat, and that's awesome. But my story was not like that at all. And I really, like, everyone who knows me from years ago, like, is always like, wow, you made it happen. Like, you really pushed and figured it out. And I went through so many job interviews before I actually landed the current position that I'm at, and I'm so happy and thankful for where I am at. And it makes you appreciate it more, you know, and it's just, you know, if you really want something, like, you're gonna make it happen, and you have to think outside the box. I'm a very, like, type of person, like, I totally believe in the quote, like, closed mouths don't get fed. Like, you have to, if you don't ask for it, you're not going to get it. I ask everybody for what I want. So if I want something, I ask everybody. People could say no, people could say yes. You'll never know, you know. If people ask you, anyone you meet, oh, you do this? Oh, I like this. Like, you know, it just starts talking, like, and that's how things kind of happen. I mean, I was actually just, like, you know, out, and I found out that, like, that's how I met, like, the person who hired me at my current position. Is we were just out at a party and we were talking, and she's like, I do this. And I was like, I do this. And I was like, oh my God, I would love to, like, work for you. And then here we are, you know? So if you don't talk about what you want, no one's going to know anything.
I agree with that 100%. Networking is key. And even you've met so many people, you went through so many processes to get where you're at now. But if you had not networked and talked to those people, you wouldn't have been there. So I totally agree with that. Amazing.
Yeah.
Tell us, what is your favorite aesthetic procedure?
I love everything. I love anything that's gonna really work. You know, 100%. I'm not like somebody who will be like selling somebody like snake oil or like the newest, you know, trend or whatever. Like, I like things that are like a sure, like, if I do this, you're gonna get this result. But lately I've been really, I mean, I love doing lips. Lips is, you know, the most fun thing. Dream about doing lips, whatever. But just doing like a whole face at a time. So just putting a little bit of filler and Botox different places and just making the person look like, you know, they did 10 years ago is so satisfying, and the person will leave and just feel like, you know, so much better about themselves.
What would you say, that's a good point, you know, I wanted to touch on that a little bit more. What would you say kind of your most dramatic change has been, or story with a patient?
Well, I had somebody recently. She was like a woman in her 50s, never did anything, and she always took care of, this is like a similar, you know, theme that we have is, you know, we'll get a woman that's in her 50s, she's never really done anything for herself, took care of her family, and now it's like time to just, you know, get ready for her daughter's wedding or something like that. And they come in and we, you know, for like, well, I'll see them like a couple months, and we'll do some laser, we'll do some Botox and filler, and she'll just look so much better and just be so much like more happy and so much more confident, you know. And it's kind of like she's finally taking care of herself and making herself feel better.
Wow, that's amazing. Changing lives.
Yeah.
That's really great. So I want to talk about a little bit about your social media. You have over 10,000 followers on Instagram. Actually, like 18,000, right?
Something like that. It's going to be growing.
And as a provider, that's huge. How did you start that? Like, why is that so important for aesthetics?
Well, first, let me say it's all organic, so it took a long time to do this. I've been doing this Instagram for probably about 5 years, and not totally consistent. Like, I would go on, and then I'd be like, you know, there's been days throughout the past 5 years like that I would get really into it, and then I'd have like a breakdown because I'm doing a full-time job and trying to like do full-time Instagram, and like I didn't realize that that's literally a full-time job. People get paid to do Instagram as full-time jobs, and I was trying to do both, and I would have like I would work 40 hours a week, and then I would come home and like just be like thinking about my Instagram, and then I would always feel guilty because I'm not studying and I'm on Instagram, and like but then I'd be like, oh well, I'm doing something. I'm not just like screwing around on Instagram, like I'm actually like trying to build my presence or whatever for work. So I had to make that like the connection that it's actually for work, and it's not a waste of time, but it's a fine line, because you can go on and then end up wasting your time, whatever. But anyway, it is, I always knew it was going to be important because this is a cash business. Insurance doesn't pay for this. People need to know who you are and see your work. And I think that it's so important because I connect with first of all, I meet so many people off of Instagram like you. And I've had opportunities that I would have never come to fruition if it wasn't for that. And I get invited to things, and I see other doctors and what they're doing, and it's always like it drives you to want to be better because you see what other people are doing, and like you want to investigate things like, does this really work? It helps you keep updated with like trends and everything like that. You find out about different learning events. I mean, the benefits are endless if you use it for the right thing. And I mean, you have to find a way to make it you, but like your professional, version of you, and make it relatable, and then educational is all the things that I try to do with that. And it really, for me, there's no secret, no shortcut. I mean, it takes a lot of time. And, people will say, I actually listen to a ton of podcasts that are free and taught you like how to do Instagram stuff. Like there's a bunch of like The Social Dentist, and who else? There's one, Gold Digger podcast will teach you how to like build your Instagram, her older episodes. But I listened to a lot of those over the years. Like this didn't happen overnight. It was like, over the years. So I really learned how to get better at Instagram. Like, while I was folding laundry and listening to podcasts, how to do that. But there's a balance, because I'm still working. I want to do my Instagram, but then I also want to, keep studying and learning and being the best, because that's really why we're here is to be a good provider. So it's a balance. It's a lot, but it's a balance.
Amazing. And I agree. It's consistency, hard work, everyday posting, finding new avenues to really reach your audience and know who your audience is. So I agree with that a lot. Tell us a little bit about, now I know you started your career in Miami, right? You've been in Miami for a long time. How has things changed since the beginning of your career to kind of now?
Well, in what sense?
I would think in more so of like how clients reach out to you, what they expect from you, how the industry is molding itself.
Well, I think that, every patient now has access to social media, and patients will come in, I want this, and this. I saw this on social media. I know I like this, and then some people don't know anything, but I think that is what has really changed is patients are so aware of the treatments that are out there because of social media, and it's becoming more and more well known, which is driving the industry.
Okay, awesome. And I agree, social media is how people connect to providers. You have the most followers, but how is your technique? They can see your before and after pictures, things like that is what people are really looking for. Yeah,
like people come to me and they're already like, oh, I've been following you on Instagram, I've seen all your before and afters, I know that's like, so they kind of like shop for you. Like they're looking for somebody, which, as an older provider, not me, but older providers, they're probably looking at this like, this is bullshit, like, these younger people are, getting all these patients and they have no experience and whatever. And it's because honestly, the reality is that that's what people are doing, and that's how people are finding their providers. And there's really no way around it. You can't beat them, join them. So you got to either hire somebody to do your social media or, learn how to do it yourself or something, because it's not going anywhere.
Yeah. And I agree. Social media is a new wave. It's the 20th century.
Yeah.
So when patients come to your office, who do you get the most look like? Like what celebrity do they want to look like the most?
So, I mean, of course, you know, Bella Hadid and the Jenners, everybody wants to look like them. And I do a lot of butts, too. I do sculpture butts. And everyone wants this, like, hip, this hip that goes like this, which the body naturally does not look like that. So they want to make, you know, they want to add all these hips to areas that don't have hips. They want their butt to be so big that they could see it from the back. But that's from... if you look at every photo with Kim and Kylie and all of them, you know, that's what that's leading from. And then also everybody wants, you know, a brow lift, and that's, you know, probably from a lot of these patients, they don't realize how much surgery and work all these celebrities have had. I mean, they literally live their life revolved around looking good. Their full-time job is to look their best, and they have all the money in the world to do it. So they're spending hundreds of thousands of dollars on the best plastic surgeons and the best procedures, you know, all the time to look the way they do. And then we have like the masses trying to look like that too. So yeah, I would say like, you know, the Hadids and the Kardashians and the Jenners for sure.
It's typical. Yeah. I would expect that. I expect that. Yeah. When I look around Miami, that's what it looks like. So for
that is what it looks like in Miami. Yep. Lips, boobs, butt. And we're at the place to do it, that's for sure. So definitely. Now I know training and going to conferences are very important. Tell us a little bit about that. Yeah, it's extremely important. That's how you keep learning and evolving. That's what I love about this field so much, is that there's always something to learn. It's always changing. Rules are always changing. New products are always coming out.
What type of name some conferences that are really good for new providers or even experienced providers? Yeah, so I'm a part of one called Med Spa Mastery. I highly recommend that one. It's a virtual conference. And that one is where they'll talk off label kind of. So like you'll get kind of the inside scoop, not just like what the reps want you to know. So I think that that's really important because it's not sponsored by any pharmaceutical companies. But I do try to go quite often to conferences, at least 3 or 4 times a year. The Aesthetic Extender Symposium is great. It's started by somebody, a PA actually in Boca, with a great plastic surgery office. So yeah. Amazing. Mm-hmm. Definitely check out those conferences because that's how you meet people, that's how you network, and that's the biggest thing, honestly. So tell us a little bit about, I know you've been in the aesthetic industry for a while. Tell us, who do you look towards? It could be on social media, it could be as far as a mentor, but name a couple of people that you look towards in the industry. I would say Dr. Sabrina Fabi in California is probably one of my biggest inspiration because she's a woman and she does she's very well respected because she's part of the education community and she's on a lot of boards and she does clinical trials and she's always up to date with the newest things and she's just so elegant and everything like that. Also, let's see. I love Dr. 𝐥𝐤𝐬. I love seeing all his work. Limor Weinberg, Beauty Bay on Instagram. She trained me on everything, and she's the kindest, humblest, coolest person ever. And a lot of times when I owe everything to her. I mean, she trained me on everything, and when you have somebody training you, like in the medical field, it's very common for the person to be like condescending and rude and like, treat you like crap and be like, oh, like you should be like this or whatever. But Limor was like the most generous, humble, calm, kind person ever. So I'm so grateful for her. There's like a guardian angel. And also, our friend Stephanie, who I met through Limor, at Aesthetic Element in Weston. She's been there for me and is totally a mentor since the beginning. So those people who are always there for you. Also, Anna Tristan at Bose Dermatology is amazing too. She's always been there for me. So it's nice to have like mentors that whenever something hits the fan, you can call them and ask them what to do. And thank God I've had so many amazing providers that have been so kind to me. Amazing. I say it's all about giving back, really giving other people the skill set that you've learned. It took you a long time to learn this and get to where you're at. It's all about giving back. Thank you so much for sitting down with me and talking a little bit more about your passion. Tell everybody what you have going on, where they can find you.
So my Instagram is The Medical Mind. I've been doing, so basically I'm at Hochstein Med Spa in Miami, and we're doing so well. I'm so grateful for my office and my staff, and we have an amazing family here. We love our patients. We try to have fun every day, and we always, do our best, and I'm just so happy here, and I'm just really working on everyone's always like, are we going to open up your own thing or whatever? And I really just want to become the best where I am. And that's really what I'm focused on right now. Just getting better and better, learning as much as I can. Sometimes I'll do some trainings for people on the side, which I'm starting to do that, which, I love teaching. I'm actually pretty good at teaching, which I never thought I would be, but, so just, things like that, just getting better and better.
Awesome. Well, thank you so much. And until next time.
Bye.